this test the knee for ligament damage, the anterior cruciate ligament, and the posterior cruciate ligament we can test the integrity of by doing a gliding movement by moving the tibia over the femur, so moving it back and forward. So I just sit up on the table to stabilise that lower leg. I'm bringing my hands up into that popliteal area, the back of the knee, and positioning my hands over the front of the tibial tuberosity, so I'm gaining access from the front there. Now, to test the integrity of my anterior cruciate ligament, I am pushing posteriorly, and to test my posterior cruciate ligament, I'm dragging anteriorly. So I'm moving that lower leg over the top, or giving that shearing force over the top of the femur and dragging that forward and backwards. So there's not much movement that's happening there, and that's because the ligaments are intact. If there was damage to one of those ligaments, we'd be seeing a greater joint laxity in either the anterior or the posterior movement. Having said that, if someone had damaged or stressed that either of those two ligaments, you're not likely to see them in your clinic. They're more likely to have already had that assessed and treated and be in the rehabilitative stage before you get to do that test. But it's handy to know if you are working in the sporting capacity, if you're working with pre and post event massage and someone injured themselves at the time and you were the first on call there from a first aid point of view, you could check the integrity of the ACL and the PCL. So that's anterior glide and posterior glide.